Hi everybody, once again Dr. Salim is here with you guys. Let's discuss about the 5 windows of echocardiography, adult echocardiography. Maybe you may have a patient in an emergency room or somewhere. So where is a crush protocol for that? Easy and simple. We have 5 windows, as you know. We have parasternal long axis, we have parasternal short axis, and then we have apical windows. In apical, of course, we have 4 chamber, 3 chamber, 2 chamber, and 5 chamber. And then we have subcostal and also suprasternal notch. So for this, let's quickly look at this, how we find these windows. So first of all, I will tell my cameraman to come this way. And look at here, we do a circular move and to find the best window. So this is a circular move, and then meanwhile, we're looking to the screen also. So look at here. If you find it, now look at the screen. So I found it. So keep in mind, the notch of the transducer is on towards the 3 o'clock, or you can say to the right shoulder of the patient. So this is a nice, we can say, parasternal long axis window. You can see the mitral valve, you can see the left ventricle, left atrium, aorta. Now, I want to see a little bit more about the aorta. So we'll try my best if I can open. You can move a little bit superior and maybe a little bit heal the probe a little bit. So you will be able to see the aortic valve, sinus of Valsalva, and also will be able to see STJ or sinotubular junction, and then a little bit of ascending aorta. So this may help a little bit. Now you can see here, look at here, the ascending aorta is opening better. Now on the same parasternal long axis, if you want to have RVIT and RVOT, so for the RVIT, right ventricular inflow tract, like tricuspid, angle your probe or tilt your probe to the right shoulder of the patient. And for the RVOT, to see the pulmonic valve, so tilt the probe or beam of the sound towards the left shoulder of the patient. So you can see, now look at here, this is our parasternal long axis window. If I tilt the probe towards the right hip of the patient, simply you will see this is your tricuspid valve. And that, just in case if you want to see any, you want to see any pathologies or anything, so simply you can put color on. So like you can put the color on, just in case. Maybe your color gain is a little too much. So anyway, we're just talking about the windows. So this is, you can see tricuspid valve. Now the same probe, if I beam the sound, tilt the probe more towards the left shoulder, now you will be able. This is parasternal long axis. If I tilt the probe more the other way around, the opposite of the RVIT, then I will be able to see pulmonary valve on the corner. So that will be your pulmonary valve here. That's the right ventricle, and this is the pulmonary tract, and you can see pulmonary valve. Now, the other window is, it's called apical chambers. So for the apical chambers, we have 4 chamber, 5 chamber, 3 chamber, and 2 chamber. How that works? Number 1, you have to put your notch of the transducer toward the bed or 3 o'clock of the clock. And then for the 5 chamber, you tilt the probe a little bit superior. For the 2 chamber, you put the notch of the transducer straight to the 12 o'clock. And then, or 1 o'clock I can say. And also for the 3 chamber to have it, that's exactly the parasternal long axis, but you just take that picture in the apical area. So let me see here. Now, let's find it. Better to come from where you don't see anything and slowly move, and then the heart will show up. In case, the best way is, I will tell my patient to breathe in and hold it. So now you will be able to see all the 4 chambers. So now you can see all the 4 chambers. Looks like 2D gain is too much. And where's the dynamic range? Let me decrease the dynamic range a little bit. Yes, perfect. So now you can see simply the 4 chamber easily. If you want to see the apex, you can move your TGCs also. So to see all, this is 4 chamber view. Now, like as I mentioned earlier, if you want to see the 5th chamber, there is no 5th chamber, but we are opening the aorta. Look at here, aorta is opening, right? That is the aorta. Now it considered as a 5 chamber. 1, 2, 3, 4, 5. Now, what I did, I just tilted the probe a little superior. Now let's have 2 chamber. How that works? the notch of the transducer from 3 o'clock, you make it 1 o'clock or 12 o'clock, I would say. For example, this is a 4 chamber, so I will just simply move it. Look at here. Now you only have 2 chambers, the left atrium and left ventricle. Like that's the best window you can have if there is anything concerns about the left atrium, left ventricle, and also mitral valve. So that will give you like the best. And also look at the flow; it's completely parallel. And that area. Now the 3 chamber, I will find the parasternal long axis, and then I will move towards the where the nipple areas, just 2 fingers below the nipple area for the male. Just keep in mind, that's important. And then you will find it for them. So I will find this is his parasternal long axis, and I will just move the probe below. And now, here it is. So you will have the 3 chamber. 3 chamber means aorta is open, left atrium is open, and left ventricle is open. And that's considered as a 3 chamber. You can put the color, you can put, like you can do your other measurements and all those things. This is the two. Now, let's do the subcostal. Okay, I will tell my patient to lay down straight, yes, and bend your knees. No, bend it, perfect. And again, the notch of the transducer where you can see the light is on, that will be towards the 3 o'clock. So look at here. Have my camera in here. So you can see this is the subcostal area, and you just push a little bit and tell the patient to breathe in. Breathe in and hold it. No, breathe in and hold it. And hold it, hold it, hold it, hold it. Let's see. So I'll make it a little bit brighter. Now, if you look at the screen, yeah, breathe normal, breathe normal. Yeah, just normal, normal. Yeah. Okay, breathe in now. And hold it, hold it, hold it, hold it. So you will be able to see subcostal. If there is any congenital heart diseases, that's like the best window for that. And also, easily we can find if there is a pleural effusion, pericardial effusion, that's another better window for this. Now, let's do the last one. So, on the last one, we will just look to the suprasternal notch. That is for if there is any type of ascending aorta or descending aorta or the arch problem. Again, the notch of the transducer is completely straight. Look at here. So that will be the better window. You can see what I see. I can decrease my depth a little bit because it's a little too much. So you can see all the 3 branches also, and I'm in it, left CCA and left subclavian. So this is, you can see here, that will be our suprasternal notch. In case if you want to confirm it, just turn on your color on, and you will see. So you can see the Doppler shift here is a negative Doppler shift, and if I move my probe a little bit like this way, more down, you will see the ascending aorta as well. So these are all the 5 windows. Quickly, fast. If patient come with any chest pain or anything, you will be able to find if there is any considerations. So you will be able to find it. It can be anything related to pleural effusion, pericardial effusion. It can be valvular disease. It can be myocardial, any kind of diseases, or we can say ischemias or coronary heart disease or whatever. So it will be easy to find it. These are the 5 windows. We use it for adult echocardiography, and I hope this will help you guys. If you think these videos are helpful, so please share it with all those people who are in this field. And please do not forget to subscribe the channel as well. Take care.